After the discovery of OCT angiography, visualization and perfusion status of the retinal vasculature has become easier to evaluate. Decreasing perifovea capillary blood flow, seen in changes in the morphological area of the fovea avascular zone and macular vessel density, may reflect macular ischemia, which is a risk factor for diabetic retinopathy progression. The purpose of this study is to evaluate macular vessel density using clinical parameters in patients with type 2 diabetes mellitus without retinopathy. This cross-sectional study enrolled 32 participants, 63 eyes, who met the inclusion criteria. It divided into two groups. Group 1 is 16 diabetes patients, consist of 32 eyes without retinopathy, and Group 2 is normal eyes. We correlated the clinical parameters, such as age, HbA1c values, disease duration, and contrast sensitivity to central and whole macular vessel density using OCT angiography. We found central macular vessel density in the diabetic group were significantly lower than in healthy participants. The whole macular vessel density was also lower in the diabetes group than in the healthy groups, but the difference was not statistically significant. The age of diabetes patients has correlated with central and whole macular vessel density. But we found no correlation of HbA1c levels, diabetes duration, and contrast sensitivity to macular vessel density. Macular vessel density was lower in diabetes patients without retinopathy than in healthy patients. In patients with diabetes, macular vessel density decreases with increasing age. We failed to find a correlation between macular vessel density and the HbA1c value, disease duration, or contrast sensitivity. These data may help us to understand the pathology of diabetic retinopathy, even though retinopathy has not yet occurred. These findings also suggest that the central macular area can be used as a marker because it is sensitive to hyperglycemic changes and is susceptible to ischemic conditions.